All right, last item, and I'm very excited for this item. This is considering approval of a proclamation recognizing May 16th, 2018 as Stepping Up Day in Marion County. And we have Sheriff Jason Myers, District Attorney Walt Beglaw, and Health and Human Services Administrator Carrie Moeller. Good morning.
Morning, Commissioners. For the record, I'm Jason Myers, Marion County Sheriff, and seated next to me is Walt Beglaw, District Attorney, and on his right is Carrie Moeller, Health and Human Services Director. We're here today to recognize and ask for a proclamation around Stepping Up Day. As you probably remember, in 2016, Marion County became a Stepping Up Initiative county, and the Stepping Up Initiative is aimed at reducing the number of people with mental illness in our jail, and I would extend that in our criminal justice system, and connecting them with community wraparound services where they're better served. So I'm going to let Walt set the stage, and I'm going to talk a little bit about what we've done, and then Carrie's going to talk about the outcomes.
Good morning. Thank you, Sheriff, Madam Chair, members of the board, and all our community members listening out there. We are really honored today. This is a day of action, but in Marion County, around the challenges we face in mental health and mental illness and the public safety system are paramount. And we have an enduring commitment that goes back a generation here in Marion County, trying to address that really critical intersection of those impacted with mental health concerns and the public safety system. And we could not care more about changing the trajectory for those impacted with mental illness in our community. And I really like to be a part of this team. This is really a privilege here to have your sheriff, your health leadership, your district attorney, and your board in one room, really kind of rowing in the same direction to reduce those with mental illness in our jails, and then find community supports for them. Really brings together probably one of the most compelling issues in public safety. And having been in public safety for 30 years now here in Marion County, I think this is one of our top priorities. There's a couple of things we've really recognized, and the Stepping Up Initiative, what it allows us to do is really kind of bring under one roof all of the great things that are going on and align some of these efforts, from our mental health court to our court, our crisis outreach that you've all heard about, our mobile crisis, all these different pieces that we're going to talk about today. What we know is that incarcerating, putting people in jail who have mental health diagnosis or concerns, is detrimental to their health. And for the most part, those who have committed minor offenses, who have mental health concerns, get worse in jail, and they should not be in jail. And we can find community treatment, support, housing, wraparound resources that really are more effective in so many different ways. And so that's the message here. We as a team here want to ensure that our jail and all of the assets we have working in Marion County, we prioritize them. We don't need to use our jail. We can use other means to change their lives. And so that's really the starting message. We've recognized that here in Marion County. We have great things moving forward, and stepping up allows us to step forward with that initiative. So with that, I'll turn it back to the sheriff to kind of talk about what those points are that we have set in motion.
Thank you, Walt. I can't underscore the emphasis around the collaboration and the leadership that it takes to move these programs I'm going to be talking about. And we've been at it for well over 10 years, and we're continuing to evolve. We're continuing to build the system and make it even better. But it's been that collaboration with the Board of Commissioners, with our health director, with the sheriff, with the district attorney, and our local law enforcement, all working together on this issue, because it takes all of us working together to build these programs and help these people in a time of need. We kind of got our first foot in the door with this issue, and we started on the front end of the public safety system, which is law enforcement, where people come into contact with individuals that have a mental health concern. We started with crisis intervention training, which is a 40-hour training. It's a national model around identification, identifying when somebody has a mental health concern, de-escalating the situation, and then referral to services. To date, over the 10-year period, we've trained in excess of 600 law enforcement officials, both within our county and outside of our county. That training continues. It's held twice yearly, and again, it's a collaborative effort of all the stakeholders working together to do that training. So we started with that training, and then we added our court crisis outreach response team. That's a deputy that's teamed up with a clinician that takes referrals from law enforcement of low-level offenders who are coming into contact with law enforcement quite often. What we do is we meet them where they're at in the community, and we connect them with services. And this partnership between law enforcement and a clinician works magnificently because you bring the best of both worlds together. Through the help with the state, through funding, through OHA, the Oregon Health Authority, we've added mobile crisis teams. These are sheriffs, deputies, police officers from the Salem Police Department, Woodburn Police Department that are paired up with these clinicians, and they actually respond to calls in the now. So if a crisis call comes in or a call involving somebody that has a mental health concern, that law enforcement officer and clinician respond in the moment, de-escalate the situation, and refer the individual to resources. We found this program to be working magnificently, and the outcomes have been less people going to jail, more people being connected to services, which is a good outcome for the community and a good outcome for the individual. We also began to realize that not at all times are these specialized teams in the law enforcement section on duty and able to deal with folks. We found people still coming into our jail with mental health concerns with lower level charges, as Walt mentioned. And what we really try to do is ramp up the services out of the jail. So we have 4 clinicians that work out at the jail that cover 7 days a week, so that if somebody comes into custody that has a mental health concern, they're able to access services with the clinician. One of the other things we added, and it's been more recently in the last 2 years, is we have a prosecutor that specializes in the behavioral health individuals. And her job is unique. It's not to really prosecute, but it's to connect to services. It's to monitor those that individuals that are in the state hospital, and ensuring that we're passing information and making the best decision with those individuals, and when appropriate, getting them released as soon as possible and connected to services. That position itself has been fabulous addition to our system. And then the Psychiatric Crisis Center, that's been in existence, I think, for over 20 years. It's probably the only center like its kind in the nation. It's 24 hours a day, 7 days a week, 365 days a year. That's a drop-in center that people with a mental health crisis can walk in, they can be dropped off by law enforcement, and they can connect with services. And it really, that is the central hub that all of our services work out of, because that's where we can make connections for medical providers and wraparound services. We couldn't do this alone. Well, there's great partnership at the government level. We have a lot of nonprofit organizations that come alongside of us. Bridgeway Recovery Services, Northwest Human Services, the Salem Free Clinic. There are a variety of different other nonprofit organizations that partner together with us and provide these services. I would tell you, I have the opportunity to have traveled around the state. We are the gold standard in our state around the Stepping Up initiative and diverting individuals with mental health concerns out of the criminal justice system. And Carrie's going to talk a little bit about our outcomes.
Thank you, Sheriff Myers. Carrie Moeller again, Health Department, Human Services. So I just wanted to underscore the message here today about our collaboration and the direction and leadership from the executive level here, including the support from the board's office to make these changes. What I think we're talking about as a cultural shift and a system level change to think differently about how we respond to people who have mental health challenges. Together with the leadership here and across the state, we are considered the place to go to and learn from. We have people who come to this community all the time who want to learn and sit with us and see what's working. Some of the changes we've made that the sheriff and the district attorney are talking about today are people around the state are looking to replicate those because of the success of our service. And I wanted to say that our community is stronger for the efforts that we're making here collectively. When we can serve people in the community, in their homes, wrapped around the service and supports that they get in their community, it makes the community a better place, and it allows the criminal justice system to put their energy where it should be with those folks who create the most risk for us in our community. And I think these wonderful teams and this collaborative effort that we've brought together, sometimes we think about it as these big interventions, but really it's the day-to-day contact that we're having, the training, the CIT training, the ride-alongs, the mobile crisis. We often de-escalate a situation before it gets really big and has a very significant impact to people. And I think that's really the heart of the incredible work that we're doing. We have seen a decline over the years in our bookings. So we have folks in the jail who help get people diverted to the community once they've come in. But I think our ability to, in the moment, divert people, make contacts with people to keep them out of the jail has been very successful. But I will say we've seen from the early 2000s to today, more than 5,000 people who are diverted from bookings annually. That was our most recent statistic. Oregon State Hospital. Oregon State Hospital provides a valuable service and resource to this community, but there are folks who we can serve outside of the Oregon State Hospital and more effectively. So Sheriff's comments about the work that we're doing with the Deputy District Attorney has been unbelievable. There's no other way to say that. And again, people are looking to us to see how they might replicate that, but to have somebody who understands internally the legal system and how to help process people through that, who understands the state hospital and can recognize when people are languishing there, helped facilitate a communication across all systems to ensure that people who are in the state hospital are being treated and answer to their charges and are discharged as timely and quickly as possible. That has been huge. We get a report from the state. Marion County is leading in so many ways here. So for those, there are individuals who have serious offenses who do need to go to the state hospital to answer the question about whether they can stand trial for their charges. And we have had very little impact on those people. And I think the lens is right there, that we understand that those folks who pose a significant risk need to be there until they have the ability to stand trial. For those lower level misdemeanor offenses, this work has been profound. We have seen almost a 50% decrease in the number of people who wait for periods of time in the state hospital, and which is exactly what we want. But compared to the statewide average, they're seeing an increase. So our 50% combined with the state's increase of about 38%, I think is remarkable. And the final thing I'll add in terms of our outcomes here is what we call community restoration, and that's the ability to treat people in the community, to wrap services around them, provide mental health and psychiatric treatment, social service supports to help them regain their ability to stand trial, but we do that in the community rather than in the hospital. So we've seen our hospital numbers decrease because of that. The Oregon State Hospital reports it costs about $1,000 a day to serve somebody in the state hospital. Those people who are waiting to stand trial spend about 74 days on average. That's $74,000 per individual who goes in the state hospital waiting to stand trial. And over the last few years, in 2013, we treated 7 individuals in the community rather than sending them to the hospital. In 2017, we almost doubled that, 12 individuals. So if you take that 74,000 number and multiply that by 12, the impact is very significant. And I think, again, it's, in my opinion, for those low-level crimes, it's the best place to serve people in our community. So again, these combined efforts, I think, we're doing some really fabulous things. I'm very honored to work with the sheriff and the district attorney on these efforts. So So thank you.
Well, thank you very much for the presentation, and I just want to tag on, Carrie, to your comments, because this is, I serve on the Oregon State Hospital Advisory Board, or have for the past year or so, and I think the average citizen doesn't really understand what goes on in the state hospital. So years ago, when I was a little girl, and we would go to the state hospital and sing at Christmas time for field trips and things like that, the majority of people that were in the state hospital were committed civilly. They were actually had a friend of my father's whose daughter went to the state hospital, and it was for depression. And you think about now, nobody would go to the state hospital these days for depression, but that was kind of, and I remember, Walt, when we were at the Statesman Journal and you were talking about that law enforcement in olden times could drop people off at the state hospital, right? It was kind of a community resource. But it has changed significantly over the years, and the civil commitments really have been overshadowed by, and they're called, what are the criminal commitments called? I couldn't remember the word.
Great.
The aid and assist cases, or the
No, not the aid.
Guilty except for insanity.
Guilty except for insanity, but they have a word for that, and it's escaping me.
GEI.
Well, there's another word for it, but anyway, so, because it's civil commitments and it's not criminal commitments, but it's something else. So anyway, so those are folks then that are actually tried, right? But they are found that they are guilty except for insanity, so they serve, in many ways, they go to the state hospital for treatment. It's a treatment facility, but some folks can kind of say, well, they actually serve their time, if you will, in the state hospital, and so that's a very expensive piece, but they have gone through trial. But this third area of folks, the aid and assist, and that's the 370 population, they call them, and that's named actually after a section of statute, right? The ORS, whatever, .370, right? So those folks can't even go to trial yet because they're not able to aid and assist in their own defense. So they're sent to the state hospital, and as you were saying, at $1,000 a day for an average of 74 days to get treatment to determine whether or not they'll be able then to participate in a trial to determine their guilt or innocence. And when you look at the numbers, and Jason, Sheriff Myers set some statistics over yesterday afternoon for me to look at, and so there's folks involved with felonies, but there's a number of folks also involved with misdemeanors. And so $74,000 for a person to sit in the state hospital to determine if they could go to trial on a misdemeanor seems like not necessarily the best use of resource at the state hospital or anywhere else. And so having Melissa Allison, who's our mental health prosecutor, be able to cull out those cases, and the drop in terms of what the numbers that we were sending over there and the numbers we're sending there now is significant. And when I go to those meetings, there are discussions about how they can get this population to be reduced, because I think it's larger now than any other population, if I remember the statistics. I think that actually the aid and assist population, it was kind of creeping up, and now it's actually overgrown the other two populations, which means that they have less resource to serve people who are civilly committed and people who are there for longer treatment stays who have been found guilty except for insanity. And they always say to me, no, we're not talking about Marion County. Don't you worry about it. We're talking about all those other counties, right? But we have a ways to go. So anyway, just wanted to kind of add some detail to that so people listening would understand, because it is a little bit of a complex type of status or situation that they have over there, but it's so critical, the work that we've been doing here. And Sheriff, I've got a question for you. You mentioned about the mental health workers in the jail, but my recollection is that when we started stepping up, the assessments that were done on mental health were more kind of an after-the-fact assessment, where if they were observing, if someone came and disclosed that a mental health condition, or if they were observing maybe erratic behavior, that then there'd be an assessment done. But you've kind of moved assessments to the front end. Can you talk about that a bit?
Yeah, so when somebody's booked into the jail, we do two assessments. We do a risk to reoffend assessment, and then we do a brief mental health assessment. The brief mental health assessment, that information is passed along to the clinicians if there's somebody that shows signs of mental illness and they're able to follow up with them. So, yeah.
So everyone gets one of those assessments?
Everyone that
now,
comes
right?
in the door that's booked in has those assessments done.
And have you seen differences in terms of how that's you've been able to respond to people with mental illness. I know in many ways that's while it's upfront assessment, it's at the tail end of a process. They're actually being booked into jail. But does that help us with
It does. It helps inform decision-making, so it allows the clinician that if somebody does show indications of having mental illness, they're able to connect with them and connect them to services when they're released. But we also share that information with the deputy district attorney, so that's assigned to this team, so that she's better informed in her charging decision. So yeah, it's had really positive impacts for this population and for the criminal justice system as a whole.
Great, thank you. Other questions or comments?
You go first.
Well,
You have something.
I always use this same story because, I mean, there's so many moving parts to this initiative and making a difference, but I know you talked about the mental health people riding along with the sheriff or with the Woodburn police or the Salem police, and I'm going to say this story again, you're tired of me saying it, but I was lucky. I got to do a ride-along one time with Sergeant Hickam, and we were on State Street in Lancaster and got a call for Aurora on a potential suicide, domestic violence issue, and flew up the freeway at 100 miles an hour and got to Aurora. Fortunately, the Donald exit wasn't jammed up. Got to Aurora, and he, because of his training, was able to recognize and diffuse the situation at that level. And then within about a half hour or so, up drives a Salem police car to Aurora, and out gets the mental health specialist and the Salem police officer. So I actually got to see how that. Nobody went to jail that day. They connected those people up with the services they needed and on the phone right then, and somebody, I think, followed up. And it was an example of probably 5 years ago, there probably would have been an arrest, and somebody wouldn't have been in a place where they should have been at that time. So I just want to thank you for the great work and the support that happens. And I know since then we've added one more to Woodburn, and they all work together. It doesn't matter where they're at in the county. So it's great to actually see it happen and make a difference. So we've got a lot of challenges out there, but this is great to see all the and I think Carrie, you said it, the collaboration, and I underlined that, or Walt, somebody said collaboration.
They
and
both did.
Huh?
They both did.
You all did, right? I mean, that's what's great about working here, is that people don't have silos. They just say, let's solve the problem. How do we do it? So.
Oh, I don't have anything in depth. I'm just so pleased with what you're all doing. I'm thinking back to when I first got here, one of the first jail tours perhaps, and it sunk into me that these people don't belong in jail. They need to be protected and get the services that you imply, not to be punished for something that they can't control. And I'm just so pleased to see it moving along and have a slight association with it. A little comment went through my mind, and Walt, not criticizing, mentioned about the cost. Well, that really wasn't the important thing to me. The important thing to me is to put the person where they can get what they need and protect themselves again, and maybe not take a seat of somebody in their cell if somebody really needs to be there. So I'm just real pleased with all this.
Good. So I just wanted to add one more thing that I had intended to say earlier, and that is that the National Association of Counties has been really at the forefront of making this a national movement. They have workshops on stepping up. They have webinars and technical assistance, and actually this day of action is something that NACO has designated, which is why we're here today, and appreciate again the sheriff and district attorney and our Health and Human Services Administrator putting this together. And so we will be highlighted too at a conference next week at NACO about what we're doing with Stepping Up. And we're going to be sending the video clip of your presentation to Washington, D.C. so that they can have a record of us celebrating this particular day. So again, thanks to you, and also thanks to NACO for making this a national issue, which I think is really important. Do you want to make a motion?
I guess it's my turn. Madam Chair, I will move that we approve a proclamation recognizing May 16th, 2018 as a Stepping Up Day in Marion County.
I'll second that.
All right, we have a motion and a second to approve the proclamation. All in favor of the motion, say aye.
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 It's approved. So let's see, who would like to read first? Commissioner, you want to read first?
Sure. In a matter of proclaiming May 16, 2018 as Stepping Up Day of Action in Marion County. Stepping Up initiative to reduce the number of people with mental illness in jails. Whereas counties routinely provide treatment services to the estimated 2 million people with serious mental illness booked into jail each year, and whereas Marion County takes pride in their responsibility to protect and enhance the health, welfare, and safety of their residents in efficient and cost-effective ways, and
Whereas Marion County has a tradition of leadership in investing in effective mental health services and developing partnerships between the mental health and public safety systems, and whereas the National Association of Counties, the Council of State Governments Justice Center, and the American Psychiatric Association Foundation started stepping up to encourage public, private, and nonprofit partners to reduce the number of people with mental illnesses in jail. And whereas Marion County joined the Stepping Up in 2016 to show its commitment to working on the issue locally, and
Whereas Stepping Up is hosting a day of action on May 16th, 2018, for counties to hold an event or participate in local activities to share with constituents in the progress they have made in addressing the prevalence of people who have mental illnesses in their jails, raise public awareness and understanding of this important issue, and emphasize their commitment to creating data-driven, system-level changes to policy and practice to achieve their Stepping Up goals. Now therefore, let it be resolved that the Marion County Board of Commissioners does hereby proclaim May 16th, 2018 as the Marion County Stepping Up Day of Action and encourages all county officials, employees, and residents to participate in or host associated activities or events. Thank you.
Thank you very much.
Thank you.